So, I've been reading about this decline in childhood vaccination rates, and it's really concerning. It seems like we're taking a step back in time, when diseases like measles and whooping cough were much more common.
It's a huge problem, and it's not just a matter of convenience. These diseases are dangerous, and they can be deadly, especially for young children. We've seen outbreaks in recent years, and it's a reminder that we can't take herd immunity for granted.
I'm glad you brought up the history of vaccines. It's a reminder that we've come a long way in terms of public health, but we can't afford to become complacent. We need to continue to invest in research and development and make sure that everyone has access to safe and effective vaccines.
I agree. We need to stay vigilant and continue to fight for the health and well-being of all children. It's a responsibility we all share.
I think it's also important to talk about the ethical implications of vaccination. It's not just about individual choice, it's about our collective responsibility to protect each other.
That's a great point. Vaccination is a social contract. We all have a role to play in protecting our communities. And when we choose not to vaccinate, we're not just putting our own children at risk, we're putting everyone at risk.
I'm glad we're having this conversation. It's important to raise awareness about this issue and encourage people to get their children vaccinated. It's a matter of public health, and it's something we should all care about.
I couldn't agree more. We need to work together to ensure that all children have the opportunity to live healthy and fulfilling lives, and that means protecting them from preventable diseases.
I understand that there's a lot of misinformation out there about vaccines, but it's hard to believe that people would choose to put their children at risk. It's like they're ignoring the scientific evidence.
It's not always about ignorance. Sometimes it's about fear or distrust of authority. People are bombarded with information, and it's hard to know what to believe. And when you see people spreading misinformation online, it can be very convincing.
That's true, but I think it's important to remember that vaccines have saved millions of lives. They're one of the greatest public health achievements of all time. We shouldn't let fear and misinformation undermine that progress.
Absolutely. And it's not just about protecting our own children. It's about protecting the most vulnerable members of our community, like infants who are too young to be vaccinated or people with weakened immune systems.
So, what can we do to address this problem? How can we convince people to get their children vaccinated?
It's a multifaceted approach. We need to educate people about the benefits of vaccines and debunk the myths and misinformation. We also need to make vaccines more accessible, especially for low-income families. And we need to build trust with communities that have been historically marginalized.
I think it's also important to talk about the history of vaccines. They've been around for centuries, and they've been rigorously tested and proven to be safe and effective. We shouldn't forget that.
You're right. It's important to remember that vaccines are not a new invention. They've been saving lives for a long time, and the science behind them is solid.